Oh, the nerves. Good evening, everybody, and welcome to the September Windsor Regional Open Board meeting. It's been a couple months since we've last seen you, but I just want to say hello and welcome to everybody. We're going to call the meeting to order. And first, we'd like to we'd like to respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Nisway, Skoden, Anishinaabe, the Three Fires Confederacy, Ojibwe, Ottawa, and Potome. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. I do believe that was said much better than my last time I tried it, so I do apologize for any mispronunciations. Do we have any declarations of conflict of interest? Seeing none, wonderful, thank you. Can we get a motion to approve the previous minutes? We have Paul LaChance, seconded by Dr. Freeman. Questions or comments with regards to those minutes? Seeing none, all in favor? Perfect, thank you. First on the docket today is the report of the President and CEO, David Mouche. David?
Thank you, Mr. Chair, and welcome board members to the September meeting. It has been 2 months. It hasn't felt like 2 months, so welcome. And I'm gonna go through a slide deck, and I'm gonna have some help with from our Chief of Staff, Dr. Wasim Saad, as well as our CNE Chief Operating Officer, Karen Riddell. So just to give an update on where we stand with respect to Windsor Essex and our COVID infection rates, this is very recent data as of the period August 29 to September 4th. So it's very recent. And you will see our weekly incident rate per 100,000 is 90 cases. And that's the highest in the province of Ontario, Windsor Essex holds, and one of the highest in the nation right now. And another high number is the one next to it, the 19.5 per 100,000. That identifies cases that are purely community spread and can't be associated with a direct contact, but are being acquired in the community. Our weekly positivity rate is 9.29%, which again is a very high number. And our R number, our reproduction number, sits at 1. From my understanding today, the province dipped possibly a little lower to 0.9. So you want to be lower than 1. And what that is for every single individual who's infected, you're infecting other individuals. And the higher that number is, the more individuals that are being catching the virus from the one positive. So again, these numbers are not trending well, especially when the Ontario average weekly incident is 34.7 per 100,000. We're far in excess of that, basically 3 times ahead of it. And 90 actually is a little lower than what it has been. So we start off entering wave 4, being part of wave 4, into wave 4 with some very high numbers. And this has been going on for definitely over the last month, 6 weeks. So they're starting to build up. So where are these cases at? And this is from a WeChew slide. And I think it's very important because it's going to tie into our vaccination rates as well. So when you look at where we're getting these cases from, the bright green is overall, the darker green is over just the last 2 weeks. And you'll see our 0 to 19, our 20 to 29, our 30 to 39 age group. So basically, the age group from 0 all the way to 39, that is driving the current COVID positive rates, where the percentages are very high in and of themselves, making up the percentage of cases, Plus, they are dramatically higher than they have been since the start of COVID, just over the last couple of weeks. So that'll tie into the next number, which talks about the vaccination rates and the individuals in that group and the vaccine status in that group. So what WeChew did here is they're breaking down that currently the rate of infection amongst those unvaccinated is close to 6 times greater than those that are fully vaccinated, just based upon our cases for the month of August. And you'll see on the bottom left slide, it shows the unvaccinated and their rate per 100,000 as compared to the bright green, which is fully vaccinated, just in Windsor alone, and how the unvaccinated are driving our positive numbers here in Windsor, Essex, our positive COVID numbers. The big slide to the right was taken off the provincial website today, which basically shows over the last 7 days, a 7-day average, just the differential between those who are fully vaccinated, which is the bottom green line, to those who are partially vaccinated, which means less than, which is more than 1 dose, but totally unvaccinated. You'll see the unvaccinated and the partially vaccinated are driving just the number of cases of COVID in the province of Ontario. Then we go to the next slide, and this is where it all unfortunately ties together. Again, we looked at the age group from 0 to 39, and they were the predominant age group that were spreading the infection and getting COVID, and then affect spreading it. Is their percentages of single doses at the top left, and you'll see our numbers there, and I'll highlight where we sit provincially. And on the bottom left is fully vaccinated, so those that have had 2 doses. And you'll see our 12 to 17 fully vaccinated in this slide, and this goes to the start of August. In the month of August, was sitting at 53%. The 18 to 24 was 54%, and our 25 to 29 was only 58.2%, and then 66.7. Now, over the last couple of weeks, those numbers have increased. So over to the right is kind of the latest and greatest numbers that are 3 days old. And you'll see our 12 to 17, at least first dose, was 65.8% up on the top left. It's now jumped to 69.3%. So that's good. The problem is you'll see there's a minimum maximum number there, and that's for the whole province. We are still below the provincial average for that age group, and technically for all of these age groups, we're below the provincial average. So we've picked up some vaccinations over the last couple of weeks. A big push both by the city, county with their lottery system, the vaccination passports, the return to school. We've really tried to push to get this number up, but it's been a difficult number to get up. And unfortunately, now we're starting to see it with some of the school outbreaks, is the impact of all of this and the low vaccination numbers amongst this group, and they're driving, unfortunately, the high rates of COVID right now. So I'm going to pass it over to Dr. Saad to talk about the approach we're taking both locally and provincially.
Thank you, David. So the layered approach that we're choosing to use, which everybody else is really for the protection in wave 4, breaks down really into both personal responsibilities and shared responsibilities. We know from the beginning of the pandemic, before we had any type of vaccine or potential therapies, it was always about physical distancing. And if you got sick, you stayed at home. And we know obviously that that's not enough to control the pandemic. People still want to get out there. And so you have, potential mechanisms for the virus to continue to propagate. The use of masks, of course, we know it will prevent the transmission of droplets in your surrounding area. Adequate hand hygiene and cough etiquette are critically important. And, with what we've employed at the hospital, including face shields and covering to try to prevent staff members and people to touch their face, is another way, again, from a personal perspective, to try to prevent the transmission of the virus. And then you have the shared responsibility, which includes things like contact tracing and testing, immediate testing to see if you have it, and then isolating yourself if you do. Ensuring that the environments that you're in have an adequate ventilation to prevent droplets from circulating in the air and potentially infecting you that way. And of course, being outside when feasible. Quarantining and isolating if you do have either a contact with somebody or if you have a high risk exposure. And then, of course, getting the message out to both the community, that's our responsibility, as well as the government's responsibility, to make sure that people do have the access to the resources for both testing as well as vaccination. And of course, the last one, which is the main one that we have as a tool to prevent the spread of infection, is vaccines. And that's going to be critically important to ensure that everybody who is eligible for a vaccine gets vaccinated to stop the spread. What the numbers look like provincially, and this is updated information as of this morning, and the number we're looking at really is the ICU capacity, because when you look at all the previous waves, what really drove the lockdowns is what the projections looked like from the science table as to what ICU capacity was going to be like. If you knew your ICUs were going to become overwhelmed, that is usually a red flag and a trigger to start with lockdowns, because you want to still be able to look after patients who are going to need the ICU for other reasons. People have heart attacks and strokes and trauma and all those other reasons. And so you have to be able to protect critical care capacity. Right now in the province of Ontario, there are about 120 patients who are either unvaccinated or partially vaccinated in ICUs, and only 8 are fully vaccinated. So that's a 94% rate of patients in ICU that are either unvaccinated or partially unvaccinated. So we know clearly that this vaccine, and we've known this for a while, this is not what we call a sterilizing vaccine. It's not meant to completely prevent an infection. It does not make you bulletproof. But what it is meant to do, and what it has been doing, is preventing ICU admissions and preventing deaths, to preserve our ICU capacity and our hospital capacity so that we don't have to go into lockdowns. In the numbers in hospitals are slightly higher with respect to fully vaccinated patients, but the ratio is still far overwhelming when it comes to patients who are unvaccinated or partially vaccinated, with 82% of patients in Ontario right now not in an ICU that are either unvaccinated or partially vaccinated. Our local statistics, and again, I always caution people to look at this with a grain of salt because you have a very small sample size. The province of Ontario, numbers nationally and numbers internationally all support this. It's not that these individual numbers are far off, but in our ICU currently, we have 4 patients in the unit, and none of them are fully vaccinated. 3 of them are unvaccinated and 1 is partially vaccinated. On the floors outside of the ICU, we have more patients, again, that are either unvaccinated or partially vaccinated, but we also have patients who have had their full doses of vaccine and are in hospital. And you may ask yourself, well, are these vaccinated patients different than anyone else for them to be in hospital? And although the ministry is not really keeping track of those things right now, we as a hospital and other hospitals have been looking at this. And I can tell you that the patients that are fully vaccinated and end up in hospital or in ICU are not the walking well. These are not your 30, 40-year-olds with no medical comorbidities. They usually have other comorbidities, obesity, heart disease, are on multiple medications, and are fully vaccinated and are ending up in hospital. But again, the key point here is they're staying out of the ICU for the most part, and we're preventing deaths, which is the main reason why we're still recommending the vaccines for everyone, obviously. And then there is another number and a statistic about the resolved patients. We've had 10 patients with COVID-19 in hospital that are resolved. The important thing here to remember is just because they're resolved doesn't mean they're no longer occupying hospital resources or that their illness is gone. We know that a lot of patients suffer with long haul symptoms, and they are inpatients for quite some time. And again, depending on how old they are and how many comorbidities they have, they could stay in hospital for weeks and sometimes even months. And even from there, end up going to rehabilitation services for weeks or months after that. So it's not just a matter of who has it right now and who's occupying our resources. Even resolved cases are putting a burden on the healthcare system.
I will now pass it over to Karen Riddell, our CNE COO.
Good evening, everybody. So I'm going to talk to you about our assessment centers a bit, because this is another layer of our response to the COVID pandemic. So we all know the importance of identifying cases early, getting testing done early, identifying contacts, etc. So up until just last week, we had been running our Sept campus COVID-19 assessment center 7 days a week, seeing all ages for symptomatic testing only and by appointment only. But what we were seeing over the month of August was an increasing demand for pediatric testing. So our numbers were significantly increasing. You can see the increase in the numbers on the graph there. What we started planning for, and in preparation for schools going back and to be able to address the demand in pediatric testing, we opened up our pediatric COVID-19 assessment center. So that assessment center was open 9 days ago. We've already seen, and by the end of the day today, we'll have seen 500 children through that clinic. So the rate of symptomatic children coming in is very high. So we're at about a 99% COVID-19 testing rate in that clinic. So it's obviously filling a big demand in the community. We've already seen in our community, we had an outbreak declared at a school in Amherstburg. They had a large cohort dismissal, and we are expecting to see more of those. We're just into our first couple of days of schools being open, and we want to ensure that we've got quick testing available for our children. The important thing to remember here is that a large portion of these children do not yet qualify for vaccine. Any children that are born after 2009 do not yet qualify. So we have a large cohort in our population that is at risk for both getting COVID as well as transmitting. And then the other, we do have other community-based resources that are available to help support symptomatic testing. So we've been partnering with MedLabs of Windsor. They do provide free of charge COVID symptomatic testing. They did just have 2 sites, and they've opened up 2 additional sites to respond and keep it accessible to our community. So they're available in LaSalle, downtown Windsor, Leamington, and their latest clinic is opened up in Tecumseh. Those hours and all of our COVID-19 testing is available on our WRH.on.ca website. And we have both online booking and telephone booking available for all of those clinics.
Thank you, Karen. So one of the things I want to end on is something that find interesting, hopefully you find interesting, and something we're trying to do at the hospital and have been doing for the last couple of months. One of the issues that's been identified clearly as a result of COVID, and it was highlighted by Dr. Saad in the Swiss cheese approach to dealing with the pandemic, is ventilation and air exchanges as an important tool for mitigating COVID-19 indoors. And there's been some studies we came across that showed that higher levels of carbon dioxide in a room, it's easier for infectious agents such as COVID to spread. And European countries, in particular Belgium, and also the province of Quebec, have adopted air quality standards that relate to carbon dioxide levels. So what they basically are doing is, in Belgium, is requiring every single public facility to have a carbon dioxide device that measures it to determine if there is proper air exchange or airflow in a particular setting. So one of the things we struggled with in a hospital is we have, say, staff rooms or areas where staff go, and we've limited the number of individuals that can access those rooms. And also we require staff to wear PPE unless they're eating, and then they make sure they're socially distancing. But even with that, that's just a very generic type of test we're using. So what could we add to try to see if there's a proper air exchange? So when they're in the room, maybe 2 people is too many for the particular room. Maybe only 1 can go into the room. Or maybe because the room doesn't have proper air exchange, we should have 0 in the room and the room should be closed. So by using these carbon dioxide devices, and they're over to the right, we've installed them in approximately 20 rooms across the 2 campuses, and have followed the standards with respect to CO2 and air exchange. And it's an objective measure of whether there's proper airflow. Just because your carbon dioxide measurement is, say, above a certain level, does not mean you have COVID. You still need a positive COVID individual in the room to spread it. But what it does mean is the environment, unfortunately, is ripe for the spreading of COVID. And it's an objective standard we use at the hospital. So in particular rooms, we have this document over to the left, which for staff, it explains what they're looking for. And when they go into the room to see what the different levels are, and if it exceeds a certain level, to immediately exit the room and make contact with some leadership to determine from, say, the facilities point of view, what's going on in that particular room and whether it should be closed. So again, we have these in place throughout the facility. And as I stated, the province of Quebec is making all schools make this mandatory in the schools, in the schoolrooms, again, as an objective measure, but we're using it at the hospital. So we put it into place so far. Our carbon dioxide levels are good. We've done a dramatic amount of work, of course, over the last couple of years, and we always have with respect to our air exchangers at the hospital to ensure that we have good air exchange in a particular unit. So that is my report, Mr. Chair.
Thanks,
And
David.
thank you to Dr. Saad and Karen Riddell for helping.
Thank you, everybody. Great information. Do we have any questions for any of the 3 individuals? Quiet group tonight. Karen, just to confirm, you don't need an appointment to show up at the OLET or Puma Center, but it is recommended, correct?
They're both appointment based.
Oh, okay.
Yeah.
Okay, so no walk-ins. Okay.
Correct. Yeah.
But you should be able to get an appointment same day.
Yeah, we always make sure that we've got appointments available within 24 hours. So if there's not next day available, we're checking that routinely. We open up additional spots. So one of the key things is to get in quickly. So we don't want kids with symptoms to not be tested for days and days. We want to get them done within 24-hour period.
All right, perfect. Thanks so much. So if there's no more questions, we will move on. We have the Schulich report in our packages, though that's for an FYI. And we'll move down to the financial presentation and treasurer's report with Penny Allen.
Okay, I'm unmuted. All right. So this is the review of the July 31st, 2020, 4 months financial report. Of course, because it starts at April 1st. The funding increase has been confirmed, and we have received in June. I have a different presentation note. I'll just read it here. Okay. The 4.1 million in funding confirmed for the medical and surgical beds and 5 acute mental for the first quarter of the fiscal year. Funding is accrued when confirmation is received via funding letter from the Ministry of Health. Funding is accrued, recognized when confirmation is received via a funding letter from the ministry. I'm having trouble reading this. Sorry. Just a second here. I think I'm gonna do it on my iPad. Sorry. Nope. Okay. The COVID-19 incremental expenses will be reimbursed in the manner as it did last fiscal year for a quarter only. For the remainder of the fiscal year, we expect only to be funded for specifically identified to be funded as follows: vaccination centers, assessment centers, patient pediatrician and long-term care redeployment, and nursing extern program. Yes, this is the current actual. It's it is a deficit from hospital operations, 8 million, and I might make a notice. There's an unapproved budget in there. That's because everything was not stable with COVID and when the further funding was going to be in. So we didn't have an approved budget. That's going to be done later tonight, but that is a budget. And that's okay. Yeah. And we have funded and unfunded revenue and expenses. And that's that one. And total operating is 9,881,804 for funding, but there's still almost 9 million for not funded yet. Okay, and then on the other, okay, that's good, yes. Year-to-date revenue, base and one-time funding. This is the amounts that are accrued for the known COVID-19 reimbursements, as they listed here. And the preferred accommodation and co-payment revenue went over 1 million unfavorable. That is basically private rooms and semi-private, and you're not allowed, the hospital is not allowed to charge for that at this time because of the COVID issues. Patient services revenues are favorable and other recoveries are favorable. Year-to-date expenses, a lot of this is impacted by the COVID issue: salaries and wages, employee benefits, medical staff, but the medical staff fees are funded through temporary COVID funding, and physician payments or offset diagnosis revenues. Meds and surge supplies are unfavorable. Drugs are favorable, but of course that's sometimes quite the case. Other supplies are unfavorable with two variances: 900,000 for cataract procedures, and then the other one, the 2.2 million for the City of Windsor for the vaccination expenses in the vaccination center. Okay, all of this is over the target, and a lot of it has to do with COVID and having to have more staffing and also for some overtime and some sick time for staff. So that's not a surprise, really, that it's over. Okay.
All right. Well, thank you for that, Penny. Appreciate it. Do we have any questions or comments for Penny or for Mark? Seeing none. Penny, can you move that?
Yes, I can. I move that the financial report with the July 31st, 2021 results presented at the September 9th, 2021 meeting be accepted.
All right. Can I get a seconder for that? Ian McLeod, thank you. Any questions or comments? Seeing none, all in favor? Perfect. Thank you so much. So I just wanted to actually go back to David's presentation. David, do you have an update on staff vaccinations and timeline for that
Yeah, thank you.
announcement that went out?
Yeah, thank you, Mr. Chair. So if, of course, the board recalls, last week it passed a motion unanimously to require staff, which includes employees, professional staff, and also volunteers, contractors / affiliates, we call them, and students, to be started with the vaccination campaign, or at least their first dose, by a date certain. And if they didn't, they would be subject to 2 weeks unpaid leave. And then following that, if they still hadn't started the vaccination campaign, unfortunately, they would no longer be employed by Windsor Regional, be allowed on the particular site, and or their privileges would be terminated. So today, Windsor Regional, as stated in that announcement last week, we were going to pick that date and announce it today, or this week, sorry. And Hotel Dieu and ourselves and Erie Shores announced that September 22nd would be the date that everyone must have at least their first dose in place, or else that sequence is going to occur as I've outlined. So that was announced to everyone today. Our, vaccination rate, when we announced the policy back on August the 3rd, I recall was around 85, 86%. It increased to about 94% as of last week. I can tell the board that it's gone up over that. Exactly what it will end up as September 22nd, we will see. But it's definitely north of 94% as we sit here today. And I would expect it'll go even higher between now and the 22nd. And especially the board might not be aware of this, but the United States, through President Biden, just made a rather substantial announcement in the last 10 minutes, 15 minutes, regarding mandatory vaccinations for federal employees and any healthcare organization that receives Medicare or Medicaid funding from the government, which is a substantial amount of healthcare organizations in the United States, clearly hospitals. But a lot of hospitals had already instituted mandatory vaccinations in the United States already, in the Detroit region. So again, September 22nd is the date, and that happens to coincide with the date of vaccine passports in Ontario. So we will be working with the staff. Some of them who are unvaccinated, I know, have reached out, and they continue to do so, to get some clinical support. And Dr. Saad has volunteered and is working with them to try to walk them through any issues they might have in order to support vaccinations. So we're moving ahead with respect to that. And as we're seeing, like I just stated, across Ontario, let alone the nation and internationally, it's where things are heading. So thank you for that question.
Yeah, thanks, David. Did anybody have any other questions? Sorry, with regards to that last piece of info. No. Okay, great. Thanks, David. So we are rolling back to Penny. Sorry, I'm a little ADD tonight. And can we get a motion for
Sure.
the?
Yeah. I will move that the minutes reports from the June 21st, 2021, and from the August 23rd, 2021 Financial Audit and Resources Committee meetings be accepted.
All right, perfect. Seconded by Paul. Questions or comments with regards to those? Seeing none, all in favor? All right, perfect. Thank you, everybody. And then we have the consent agenda. We already did that. We have the correspondence, printed matters, media reports, etc. there for your review as an FYI. Any other questions or comments from the board? Seeing none, the date of our next regular board meeting is Thursday, October 7th. It will be via Zoom. Can I get a motion to, can we get a motion to adjourn? All right, Dan Wilson, seconded by, I think I saw Mary Dawson. Thank you, Mary. All in favor? Perfect. I think we were done a little bit earlier than I was expecting. If we can be back online for 6, that would be great. That gives David some time with the media. So 6 p.m. for the in-camera session. All right. Thanks, everybody.